New research finds that shutdowns and other interventions prevented 60 million coronavirus infections in the United States, and that the policies had large health benefits. Now the U.S. is reopening. New York started the process Monday. We here in Florida entered phase 2, say for South Florida Friday. That said, there have been some concerns. Some places are seeing spikes. With close contact among protesters, there are worries about another jump in about 2 weeks' time. Epidemiologist Dr. Jonathan Kantor joins us. And Doc, coronavirus cases are rising in 20 U.S. states. Yesterday, 24,773 new cases reported. Florida saw a steady increase over the past several days. Half the states, it's been reported, may be undercounting, according to CDC guidelines. You worried?
Well, I think I certainly am. If you ask any epidemiologist, any public health expert around, I think everybody has a level of concern here. I mean, this is not surprising, but it certainly is worrying. And that, I think, is the key take-home message. We've talked about this a number of times, the idea that, when we were being really good about lockdown, about staying at home, we kept those numbers down. As you mentioned, we might have prevented 60 million coronavirus cases. The problem is we don't want all those cases to start occurring now. And that's why it's so important for everybody to take that individual responsibility and really try to limit the social contact. Even if you don't have government restrictions on what you're doing, it's so important to keep in mind that you yourself can make a difference for yourself, your family, and your community.
Now, those raw numbers don't always tell the whole story. One of the most important numbers when you track the spread of COVID-19 is what they call the R-value. It represents how many people each infected person will likely infect on average. So an R-value under 1 means fewer and fewer people will get infected and the virus starts to fade away. But an R-value of more than 1 means the epidemic will worsen. So as of this weekend, Florida's estimated R-value was 1.07, meaning the rate of spread is increasing slightly. So that's good news for now.
Right. That's good news for now in the sense that it's better than an R naught of, 1.2, 1.4, 2.0. That said, look at countries like Germany, for example, which for a while had an R naught at 0.7, and they were concerned when it went up to 0.9. So I think the key thing to keep in mind is, as you mentioned, Bruce, is that it's important to realize perspective here. I mean, definitely we want that number to be as low as possible. If we want to see a decrease in number of cases, though, that number is going to have to be less than 1. And the key thing that we can do here in terms of affecting the R naught is that the social distancing measures that we're doing, the hand washing, the avoiding those close contacts, that is really what's making the difference here. This is not something that's inherent in the virus. This is something that is based on what people are doing in response to the virus. And that's where all of us can really make a difference.
Yeah, and I see so many people who think that life is back to normal. It's not. Let's talk about the impact of the protests. Dr. Anthony Fauci says they are a perfect setup for spreading COVID-19. Understanding the validity of the protest, we're seeing blips now, but he worries that those blips could turn into spikes.
Well, absolutely. I think you're definitely, I don't think anyone's going to be surprised again if we see, increases in the numbers that we were even seeing this past weekend in response to the large numbers of protests. And again, I think we're probably going to see that in areas where there were larger protests, where there were more active protests. But I think certainly you're going to potentially, see those increases down the road. That said, again, these are, it's important to be, permitting and fostering protests, and that's a wonderful thing. But we've got to realize that if people can be as smart as possible about that, wear masks, try to limit that social contact as much as possible, which is tough when you're, when you're chanting, when you're sometimes shouting to try to have yourself heard. Those are really, important things to try to balance.
So we'll have to see those numbers when they come out in about a week. Dr. Jonathan Kantor, always a pleasure. Appreciate your insights. 7:45, time for a look-see at the weather.